You know, a Somali poet described the female genital mutilation as one of the three sorrows in the life of a woman. She said the other two is the night of her wedding and when she gives birth. But away from all of these dynamics is what the people are trying to look. This is not peculiar to the Africans or the African continent. But today we're looking at how this can actually be put to stop, because for quite a number of people, this is one of the horrors they go through on a daily basis. FGM in focus on VSA. You know, there are over 200 million girls who have been made to face female genital mutilation around the world against their wish, with majority in Africa. The UNFPA projects that at least 68 million more girls will be cut by the year 2030. FGM is seen in girls as young as a day old and as old as 49. It is, however, seen more in girls aged between 0 to 15. There are 4 ways through which girls are mutilated, and they are through the cutting of the clitoris, excision of the labia minora, tightening of the female genitalia cord, infibulation, and re-infibulation. In Africa, at least 29 countries still practice this age-long but inhumane practice. FGM poses many threats to the health of its victims. It also affects their sexual liberty and confidence. It is responsible for the inglorious statistics of a death rate of 2 babies per 100 deliveries in people who have faced FGM. While it's not limited to Africa alone, much of the practice is found on the continent, and its prevalence in Mali still at 73% as early as 2015. Well, I won't be unpacking female genital mutilation alone on VSA today, as I'm being joined by Haithar Ahmed, a child protection specialist at UNICEF Kenya Country Office, and Nurla Gollo Halake. She's the Chief Executive Officer of Marsabit Women Advocacy and Development Organization. Welcome on the program. So first round, I'd like to go to the CEO of Marsabit. Help us here, Nurla. You know, female genital mutilation is often described as female circumcision locally, and this is the view many people on the continent hold. Can you explain the difference between both practices and how important or necessary this practice
is? Female genital circumcision is lighter than female genital mutilation because the female genital circumcision, as you have already mentioned, there are 4 types of female genital mutilation because it depends on the severity. Cutting is just a mild cut, but in our region, it is mutilation, you know, destroying of the whole system. So the difference between female genital circumcision and female genital mutilation is the weight it bears on the severity of the cut. And the one which is practiced in the region where I come from is the most severe one. So it is not a cut, it is mutilation, whereby the whole system is destroyed, and a lot of difficulties are felt in the process of marriage, the process of delivery, in the lifetime of a pastoralist woman. The pastoralist woman is the woman I am, the communities I come from. So ours is not mutilation, not circumcision, but mutilation, because it is the 3rd type, which is very severe and is a lifetime impact, both physical, psychological, and that is why it is called mutilation. Sulaiman.
Yeah, we'll come back to you, Nuria, so that we can talk more about Ethiopia and what you are doing with your group. Haithar Ahmed, tell us what, how you see this, the kind of definition you hold. Does it actually sit with what Nuria has described? Mutilation, circumcision, are they one and the same?
And thank you, Suleiman, and thank you, my colleague who is alongside a panelist tonight. And first of all, when you look at the definition of female genital mutilation, is also called female genital circumcision, FGC, but it's also called female circumcision, FC. So in all...
Well, looks like I think well, the connection there to Ahmed has been lost. But quickly here, let me come back to you and Nuria. The numbers are staggering now that we have been able to situate what this means. It is shocking to see that 29 countries, including yours and even Nigeria, still practice it. So what is the response to calls against FGM at the community level where it is more dominant?
Of course, this is a cultural activity or a cultural issue, and a lot has been done, of course, by the Anti-FGM Board, UNICEF, and other partners. But coming from a remote part of Kenya, northern Kenya, where communication is a problem, implementation of policies is a problem, we cannot celebrate and say we have achieved a lot on eradicating FGM. These are communities where there's the cultural, we have cultural issues which are very, really strong, and communities here are illiterate, and they live believing in their cultures and their old ways of life. It's not easy. It's not a ride in the park. As much as the government have the policies, a lot of capacity building has been conducted. These are communities who move from one place to another in search of water and pasture with their animals, where in one area capacity building is conducted and the larger part of the population is away herding their animals. So it is difficult, and also it's a cultural belief that women should be circumcised. If you are not circumcised, you are not a full woman. These changes are gradual. These changes cannot happen overnight, as much as a lot of sensitization has been conducted. A lot is done, of course, but women also have that freedom as women to make decisions. We live in a setup where the cultural institutions are still in charge of the communities who live in the north, and the change of culture is gradual. It comes, after a long time of sensitization without giving up and continuing. So it's really not very easy. It's a little hard, but we are struggling. But I'm proud to say some milestones have been reached. Some areas have really embraced these going against this act, but it depends on the areas which are near the urban areas and the rural areas. So the urban areas are better than the far to reach areas which are back in the rural, where people believe in their cultures. So it's not easy, but we have tried. We have done a lot of sensitization. We have done a lot of, counseling in schools to girls. We have taken aboard the boy child, the men, to support us. Something is going on. Something is going on, but of course, a lot needs to be done. From my side, I feel still a lot needs to be done. We need to sit down again with our cultural institutions, who are the custodians of our traditions.
We'll come back, Nuria, allow me come in. We'll come back to that aspect. We'll look at those challenges which you just try to highlight And the good thing here is that you've agreed that the progress is gradual, and at the moment you're making some incursion, especially amongst the pastoralists, which are also a part of that community in Ethiopia. Let's go to Nairobi, Kenya, to Ahmed again. Ahmed, apologies there, we lost you for a bit there. You were trying to tell us if there was a difference between female genital mutilation and female circumcision.
And thank you, Suleiman. Again, I had challenges, but I'm back. And in terms of the difference, when we look at the WHO definition, female genital mutilation is also called female circumcision (FC), but it's also called female genital cutting, and which is just same across the board, because it always it has different classification according to the WHO, the way you have said. But in the context of community, when we go to communities, they say, for us, we cut, we don't mutilate. So in the context of health aspect, FGM, irrespective of it is done by breaking, if it is done by health practitioner or traditional practitioner, and it is just same. So in the context of definition by WHO, those names were interchangeably used than to one another. But in the context of communities, they just say that we prick the clitoris or at the clitoris, and we don't do any damage. So in this community sense, the WHO says even if you prick, the damage is also the same.
Well, I mean, quickly here, tell us what this means for you at UNICEF there in Kenya, being someone who is in charge of children, child protection. There must be some kind of advocacy the UNICEF is making in Kenya. How is this going, letting the people know exactly, as we've heard Nuria say, that this is a practice that must be stopped?
And thank you, Suleiman. And UNICEF alone is not working on this. We are supported by our great UN sister agency, UNFPA, United Nations Population Fund, and that works with UNICEF in 17 countries to address issues related on FGM, including Nigeria. And we have the work of Kenya is being led by the Ministry of Gender and Public Service, and Kenya being a premier country in terms of implementing FGM globally, and a leader in regional cross-border ending of FGM in cross-border. So the advocacy of UNICEF we are currently doing, we are doing at different levels. We are doing at the national level, where the ministries under the presidential directive to end FGM by 2022, and under the President Uhuru Kenyatta, we have 8 ministries that are working around on ending FGM, plus 2 other independent institutions, including the Council of Governors and the Director of Public Prosecution at national level. And this is where UNICEF works in terms of including policy formulation, revising these policies, providing a favorable environment for this with our sister UN agency, which is UNFPA. When we look at also at the subnational level, where we normally call the county government, this is where the rubber meets the road, because we have a subnational government institutions elected by the local communities who are practicing for this FGM. But on the other hand, we have this where the girls and women who are at risk of FGM live. So this is where the bulk of our work happens, around, and 60% of our work happens. And we normally do programming interventions, including at community levels, policy levels, coordination, and generating evidence and data that really speaks policy change prescriptions, but also programming and in terms of ending FGM. And this is where we have different cohorts. We work with religious leaders, children leaderships, youth group, women networks, and men and boys networks to end FGM. Back to you, Suleiman.
Okay, Nuria, let me come to Nuria here, because listening to Ahmed and the categories of persons the UNICEF and child protection experts like himself are working with, it comes to mind that you can't take away the culture of the people. You can't also take away the religious people or the religious leaders. At Marabith, Women Advocacy and Development Organization, how easy has it been for you to get these, categories, talking about these groups, to listen to you and believe in what you say?
Yes, Suleiman, I hope you hear me loud and clear.
I can.
Being born and brought up in this community, it's not difficult to get the categories, the different categories of people, like the religious leaders, the opinion leaders, the women, the youth within the community. Being organization working in this part of the country, it's not difficult. It's not difficult to get them, and people are ready for change, though of course they need to learn and understand in details. This is their culture. They are the ones who've been doing it for long. So it has not been difficult to have community dialogue meetings, women group meetings, youth meetings, religious leaders meetings. It's not been difficult. It has been.
Let me come in here. Sorry, Nuria. In the next decade, another 30 million girls are at risk of female genital mutilation, and it's not enough for us to think that they'll listen and not go ahead and reduce the numbers. That is a staggering number, 30 million girls. Now, what can be done to stop those girls from being victims?
Sensitizing even the girls is one of the options. Most of the times, they believe it's cultural and they must go by the culture. But now we have taken the initiative to make them understand. Being born and brought up in this community, the dangers we have gone through, the effects of FGM must no longer be a secret. It should be spoken out. And the beauty of it, Suleiman, is that this FGM is propagated mostly by women, and the men are not really aware of what's going on. So we have opened up and shared what women go through with the men. And on many occasions, the men are like, why have these women never told us the pain they go through? So I can see some light at the end of the tunnel, because it's the tables are turning. The men are also like, my daughter will not, if this is the dangers women are facing, my daughter will not go through FGM. So things have not been really very clear. It was a women's issue. It was being handled by women, discussed by women, conducted by women. But now that we are engaging our men, brothers, and our elders, and we have told them the effects we have gone through, we have suffered. I'm one of the survivors. We have told them the truth, that we are going a lot through this and that, and we have engaged them together with the circumcisers. So they have now realized it's really not a good practice, and they must not support it. So we have the support of men, and this is now changing the narrative. It has been a women issue before. Women are discussing among themselves. But now that it has been opened up to the youth, it has been open to the religious leaders. The Quran have denied that it's not in the Quran, that the religious leaders, the Muslims have said it's not in the Quran. The churches have said it's not outrightly put in the Bible. So all this has changed the narrative of FGM, and people are now thinking about it in a different manner. In a manner of, my father, I'm a father, it will not be done to my daughter. I'm a circumciser, I did it for economic empowerment, but now I no longer do it. And the girls also are empowered. Even in school, in clubs, we have clubs in schools, and the girls have learned that this thing coming to them, which they are asking for. You know, because of peer pressure and intimidation, some girls ask to be circumcised. This has now changed because we are telling them the truth. It's not easy. It's not a joke. Giving life testimonies, giving stories of what we have gone through, they are now, their attitude is changed.
I think at this point, we'll take a moment. When we come back, especially to you, Nurla. You tell us what it's been like being a survivor, and some other, hard lessons that you can share with us that just might make the next person that is about to be cut not to go through the process. That's when we return. Well, if you just joined us, you're welcome. You're watching Village Square Africa here on News Central Television, live from Lagos, Nigeria. And we have two guests from across the continent. In Nairobi, Kenya, we have Haithar Ahmed, who is a child protection specialist and with the UNICEF Kenya country office, and Nurla Gollo Halake. She's the CEO of Marsabit Women Advocacy and Development Organization, looking at female genital mutilation. Now, victims of FGM are left in a state of shock, going by what we have heard some of them say as a result of excessive loss of blood after the process. Now, Nurla, please, quickly here, we'll come to you, but let me get to Ahmed here. Ahmed, listening to Nurla before we went on the break, I think what comes to mind is that we have survivors now joining in advocacy, making your job and every other person's job easier, and knowing full well that the majority of persons who carry out these acts are women. Ahmed.
And thank you, Suleiman. And first of all, we would like to congratulate, because in the context of Kenya, FGM was a taboo. And as an African across the continent, sexual issues are forbidden at the household level, just leave off at community settings, and also social gatherings. But we are seeing our girls through education, through awareness raising that's happening, through the media houses like you, and also across other platforms and across interpersonal dialogues that is happening at community level. We are seeing our girls, our women, really coming out as survivors, really coming out as those who have been fortunate to be rescued from FGM. And this is very important, because FGM is not only a woman issue, and that's why we should not always bring only women and girls in this issue. We need to bring at family levels and at the importance role that boys and men play in this context. So it becomes a societal problem. It becomes a developmental issue that cuts across between the different genders. So when we hear, and we as UNICEF, when we establish networks and support networks of survivors of FGM alongside with other community members, we really feel happy, because we have seen allies at the community level. We've seen those who really support at grassroots level, without the support of UNICEF or other partners across Kenya. So this is a great initiative, and really sustaining and inclusion of women and survivors network in this agenda is a surest way of eliminating FGM, and is one way of establishing a low-cost intervention at community level. And as you know, development partners and donor funding is dwindling across the globe because of different issues that are happening across Europe, Asia, Africa, and other continents. Back to you, Suleiman.
Well, Nuria, let me bring you here. It's a good thing that you've been able to. First, congratulations for really, going through what the Marsabit Women Advocacy Development Organization is doing. We see that you're doing a fine job. Congratulations. And again, thanks for coming out to let people know that you are also a survivor. This just might make your work easier to seeing someone speak up and saying, look, I've been there, I've gone through this. But before we start looking at some of those things, are there reasons specifically why people cut girls?
Thank you very much, Suleiman. And one of the reasons, according to the community I come from, is that if you are not cut, you are not clean, you are not pure. So it is connected with, the aspect that our girl who is not circumcised is not clean. Another reason is that she cannot be married. The men marry only girls who are circumcised. So in order to get a husband in future, a partner in future, the girls are forced to marry. And then also there's a lot of stigma and discrimination in the community regarding the girls who are not FGM'd. The reason why they are cut, a major one, is they say a girl who is not cut becomes more hot, or it becomes promiscuous. When she's not circumcised,
I think, there seemed to be a glitch in our connection to Nuria, who is in Ethiopia. Let's quickly run to Nairobi, Kenya. Ahmed, listening to Nuria, I hope we get her back. You know, the thing here is about beliefs of the people, culture of the people. And now it's been so established that, according to Nuria in Ethiopia, they've been told that these are not even in the religious books of the people in the two predominant religions of Christianity and Islam. Does this also play out in Kenya, where you practice at the moment?
And thank you, Suleiman. And as Nuria alluded, I'm sure Nuria works in the Kenya-Ethiopia border. I'm sure currently she is within Kenya. And the reasons that she has given is, first of all, the marriageability, because girls, nobody marries if she's not cut. The other issue is promiscuity. They want to maintain virginity of these girls, and this is related to marriageability. But there are those who even say, and if female genitalia is not cut or mutilated, then it loses the beauty itself. And they say when it's cut, it's very beautiful, and all those aspects that these communities believe. And there are those who believe that when women, if they are not cut, they cannot do and participate in cultural ceremonies, including the boys' circumcision. And this really pushes so many women, married women who have been rescued when they were girls and they have not been cut, to really undergo FGM while they are women. And this pushes them because of the stigma, the exclusion, both at social and developmental levels. So this is a big hindrance to the work. And last year alone, in one of the sub-national level, in one of the counties, the courts have jailed 22 women as a result of stigma, discrimination at community level, who have been pressured to undergo FGM in 2020. So you can see the cultural aspect this has it, because you will be excluded culturally, socially, economically, and all development issues if you don't undergo. But the beauty of the things is that in Kenya we have families, we have villages that really have not cut for quite some time, including those counties that are over prevalence of FGM 70%. So in the midst of all challenges that we are facing, we are seeing communities embracing and the directives of the president really. And the one thing that's very important is that you cannot do programming without evidence. And when we compare the data sets of the Kenya Demographical Survey from 2008 to 2009 and compare to 2014 Kenya Demographic Health Survey, we have seen FGM has reduced from 32% to 21%. But also,
in all of this, thanks to what you're doing and what people like Nuria is doing. Sorry to cut you there. Let me quickly go to Nuria since I see that Nuria is back. Nuria, quickly here, we're trying to look at the life of a woman who's gone through female genital mutilation. Away from your advocacy, tell us what such, survivors go through.
Come again, kindly.
We're trying to look at what survivors of female genital mutilation go through, especially in their communities.
Yes. The survivors' time had not been easier before, but because of a lot of advocacy, a lot of campaigns, a lot of capacity building, we are now accepted in the community, and people are now listening to us. But before, we could be stoned. We could run away from meetings because people, the cultural leaders used to disagree with us. But now they can listen. There's a change. I'm a survivor myself. And when I go to the community and talk about it, I get audience, I get a change of mind, change of attitude, and I can say it's not as difficult as it used to be. But before, it was a no-go zone.
So, some of the things the communities have said will happen, if people are not being cut. I'm sure you have seen some other survivors. How true is it when they say people are not, again, we can't actually establish, talking about anything that has to do with those that are clean, end quote. But when we talk about some other, pains that a child goes through who's gone under the knife in her genitalia. How does this work with these people living in such communities to the extent, because you said something about stigma, how do the people know who's been cut and who hasn't been cut?
In our communities, the circumcision is done in age sets, and people who live in the same village know each other. And this is usually done during the holidays when the school closes. So at least within that village, everybody knows who has been cut and who has not been cut because of peer interaction. This holiday, you see 5, 6 girls cut in this house, 10 cut in the other house, because they do it at communal level. Neighbors can come together and cut their girls together, so they can easily know the girls who have been cut within that region area and the ones who have not been cut. But nowadays, it's not as severe as it used to be. Girls who have not been cut, I've witnessed, have been married. Those who have not been cut, especially those who are educated and have gone to university, you'll see them getting married and getting children. So this also contributes to the change of attitude, change of mind of the people of the communities we live in, because they can see they have husbands, they have children, they are doing their work like any other person, and there's a change of mind. And maybe, I don't know if you're going to give me another opportunity, but Borana community have declared female genital mutilation a crime. At Abagada, who lives in Ethiopia, we have apart from our country president, we have a Borana leader who lives in Ethiopia and whose decisions are accepted by all the Boranas in the world, even those living in America. So he has already declared anybody who does FGM and child marriage has done a crime in the Borana community. So this has also contributed positively to the eradication of female genital mutilation.
No, of course, you always have time on the show because this is specifically for all Africans and Africans living in diaspora to see that the continent is a better continent and an example to others living outside the continent. Quickly, let me go to Ahmed before I come back to Nurla. You tell us much more about that community where it's been outlawed. I'd love to know more about the leader of that community and what that means for the people, especially living outside Ethiopia. Child protection, Ahmed, you know, child protection rights are largely unfollowed in Africa, and you hardly hear people getting punished for it. So what's the place of the government in the presence of FGM in Africa vis-a-vis your work with UNICEF?
Thank you, Suleiman. I think it's this is very important when we address issues related on human rights issues. Upholding policies, laws, and regulations is very critical. It acts as deterrence and it acts as a punishment for those who have gone against the human rights values and principles. And in the context of FGM, and then Africa, when we look at Africa has some of the countries, including Kenya. There's an analysis done by an organization called 28 Too Many. And it had said that in Kenya, it has one of the best laws in terms of eradicating FGMs. However, as any other in African country, Kenya, we have an inadequate implementation of such laws. And there are so many reasons that makes this implementation. Some of the major reasons is that the country do not have adequate resource, and the financing of female genital mutilation, which is at the national level, the national exchequer doesn't provide adequate funding. And this is something that UNICEF and other partners and the ministry responsible for this is advocating for. The other issue is that the community, those who have been tasked to implement these laws and policies, are coming from communities who practice, and they have believed these values, some of them, and sometimes they may be clash of policies versus culture in the minds of these implementers, and these issues that are related. The other issue is when we look also the implementation of the laws, particularly even in the Kenyan context. And for example, a family of 5 children, the law says that for those who have done the cut and those who are paid should be jailed both. For example, a family who has 5, there was a lot of dilemma between implementation and children's rights on this issue. For example, a family of 5, and they have cut 2 of their daughters. If you put them behind the bars, the father, the grandfather, the mother, all of them, who will take care of these children? Will they end up in institutions that are harmful to these girls? So we have a lot of dilemmas as an institution. So in principle, we have agreed both with UNFPA, with the government of Kenya, and what is more important is community engagement and outreach program, and implementation of laws and policies become as the last resort. And the bigger and more sustainable approach to ending FGM is to win the hearts and the minds of communities who practice this vice.
And Nurla, quickly tell us. I'm excited about that community you mentioned, knowing that we have a leader on the continent whose decree, stands irrespective of where you lived across the globe. Tell us more of what this is about in Ethiopia.
Yeah, we have a community, my community, the Borana community. They are called Borana community. They are nomadic pastoralists, and they have their leader who is called Abagada. Abagada lives in Ethiopia and is the leader of all the Boranas all over the globe. And after every 8 years, there's an AGM which is conducted. They have, a general assembly meeting where traditional leaders who are selected come and make some declarations and make amendments to their constitution. They have their own local constitution, and it is in that assembly where the discussion of female genital mutilation and child marriage came up, and he outlawed both practices, saying that it is overtaken by time and the people should change with the times. And before, if I go a little bit back, before this declaration, the Boranas, wherever we go to educate them on female genital mutilation, used to tell us, until it is outlawed by Abagada, we are going to do it. So I think for us, not really I think, but I'm sure it's a milestone for us, because what people were asking for was that it must be outlawed in the General Assembly, and that has happened. But the other challenge is the communities which live in this county where I come from are 14 communities, and all of them practice female genital mutilation except the Turkana, only one community. So the other 13 will also learn from this Borana community. The predominant community is the Borana. They are the larger community within this area. If these larger communities have accepted to outlaw female genital mutilation, I think it will not be very hard for other communities living within our county to follow the same suit and accept to outlaw it in their own setup.
You see, there seems to be light at the end of the tunnel here. First, we must say kudos to the Borana community, and a big thanks to the Abagada for, outlawing FGM, which definitely, as you rightly said, will have a domino effect in other 13 communities. Let me quickly bring in Ahmed here. Ahmed, it looks like, in some years to come, if we're having this conversation, the numbers should have reduced. But, there's a high presence of HIV and AIDS on the continent. Can we look away from FGM as being, partly one of the reasons why that number is on the increase?
And thank you, Suleiman. Initially, around 1980s, when HIV pandemic was really ravaging the globe, and scientists have done research, and they've said if the blood is being used more than one girl, then automatically it will increase the likelihood of them getting HIV. But however, as communities, as HIV communities go and continue to get education on prevention of HIV, and including at community level, then that likelihood is also diminishing, because there's no direct link for that. But automatically, and most of communities that practice FGM, and in Kenya, we have noted that they normally say one blood for one girl. So, but they may be likelihood, others may be using one razor blade more than one girl. It may happen behind the curtains, but this is what we hear from community surveillance teams that we work, community monitors and community volunteers that we currently work. So, we cannot rule out, but the likelihood is a bit more slim because of the wider education that these communities are getting.
Nuria, you know, we have Ahmed here, but are there men in your advocacy team, you know, helping to sensitize people in Ethiopia?
Yes, we have men in our organization, and some of them work across the border in Ethiopia, because these are the same communities living both in Kenya and Ethiopia. And a lot of advocacy has been going on, and I thank our main counterparts, boys, young boys like school leavers, and the men we are working with who have been sensitized are now disseminating the same information across the borders in Kenya and Ethiopia. So I presume this is our advocacy has also reached. I cannot outrightly rule we are the only stakeholders, but we have other partners who have also championed against FGM, and this is the message which might have reached their Bagada, which has brought the change of mind, which has led us to the outlawed practices. So the men are really helpful, and they are a major player in this field. Yeah.
Okay, Nuria, because I was actually going to volunteer myself. I thought that there were no men in your team. Now that we've been able to establish that you have men in your team, let me ask if there are educational programs at the community level to change their perspectives and opinions on some of these cultures and traditions of pain. And who's best to educate the girls on what they need to know about their bodies?
Yes, a lot of the communities, even at the village level, and this has led to a drop of, because around, especially the rural areas, I mean the urban areas, there's a lot of sensitization going on through the local media, radio stations, the TVs, and also us and our counterparts, the stakeholders working in the abandonment of FGM are quite a number. And we have network, we have steering committee in all counties who work against FGM. We have county government who are also contributing to the same. So among those players, we have come together and we have done a lot of sensitization. Today, we are not talking of sensitization because a lot of sensitization has been done. Today, we are just looking at the milestones, the changes really taking place, and how many success stories do we have as at now. I myself have two daughters and have not done FGM to them. One of them is a university graduate. So there are many more people who are educated, those who have been in the campaign against FGM, and we can see there's a light at the end of the tunnel, and there's change of mind and change of attitude within the community.
So, Ahmed, good to know you're back. While you were away, I was asking Nuria if there are men in her team helping to push this whole narrative and see that we have a stop to this culture of cutting the girl child's genitalia. Quickly tell us how much of you know, cooperation you're getting from men in Kenya.
Thank you, Suleiman. First of all, at the national level, we have Men Alliance of Kenya, and we have Men End FGM Foundation, which works with UNICEF on issues related on working with local men and boys in terms of them establishing networks that really support girls and women in protecting their own communities and supporting outreach programs. So currently we have over 5,000 men across around 11 sub-levels where UNICEF currently works. And within these networks, they have their own peers that they work with them on these issues. So, and men and networks is something which is very important in terms of addressing these issues, because it brings back to the issue that FGM is not a women issue, it's neither a girl issue, It's a public health issue and it's a societal problem.
Well, I think at this point, I'd like to say many thanks to you both, Haithar Ahmed, who is a child protection specialist at UNICEF Kenya Country Office, and Nurla Gollo Halake, the Chief Executive Officer of Marsabit's Women Advocacy and Development Organization. You know, an old culture of discomfort and distress is still facing strong, you know, in Africa, and the solutions to issues like this must be sought from discussions and actions taken on platforms like this. So on Village Square Africa, we'll bring you even closer to the situation and what you need to know about the female genital mutilation. Many thanks for being a nice company again, Ahmed and Nurla. Remember, you can watch us live on youtube.com/News Central TV and on Star Times, channel 274. You can also check the latest updates on Africa on newscentral.africa. I'm Sulaiman, and the conversation continues here on The Square tomorrow.